Hello everyone, this is Health Highlights. Health Highlights is a show about health professionals, and the people and the stories behind the names you hear about you seldom get to meet. Now that's probably the worst ventriloquism you've ever seen. Welcome to the show. We are here today at Kids Smiles Paediatrics here in Broadmeadow, and we're going to talk to you all about kids and dentistry. Now you may not realise this, but well, I do. I have anxiety when I come to the dentist, and around about 30% of the population have anxiety when they come to the dentist. However, did you know that 50% of your kids with their baby teeth and then their adult teeth actually have decay? So to talk all about things dental, we have Helen Cornwall with us today. How are you, Helen?
Very well, thank you. Thank you for having me along.
My pleasure. And Dragon, tell you what, they are some nice teeth right there. Look at that. That's fantastic.
But alas, wasn't wearing his mouth guard, and the result was we've had a traumatic dental injury.
Oh no, that is terrible. That is terrible.
Poor old Dragon.
So I could see that would have cost some parents a lot of money.
Very great amount of money.
Absolutely. So Helen, firstly, is that accurate that 50% of our kids today actually have decay on their permanent teeth?
Yes, so the statistic is that approximately 50% of children have decay in their baby teeth by the time they are 6.
Wow.
And by the time they're 12, a similar percentage have decay in their adult teeth. So that's for the baby teeth, that's a 78% increase from the time I started practicing.
Wow.
In general practice all of those years ago. And in the permanent dentition, it's a 60% increase. So they're very sobering statistics. We're not doing so well at looking after our children and our young people and their oral health, which will translate to some bigger issues as they grow up and become adults.
Absolutely. So what can we as parents then do to actually help prevent decay in our kids?
Yeah, decay is a preventable disease.
Yeah.
We know what causes it. We have to have a tooth.
Yep.
A tooth that's got a deep groove, a tooth that's tight and close to the tooth next door, a tooth that hasn't formed properly is going to be at high risk. So we have to have a tooth factor. We need to have the bacteria that causes decay.
Yep.
That bacteria generally comes from the primary caregivers, and it sits in our mouth, and we need to have a substrate. We need something for that bacteria to use to produce acid, which causes decay.
Right.
That substrate is any fermentable carbohydrate.
So for those
anything other than water.
Anything other than water.
Anything
wow.
other than water. Our body and the bacteria in our mouth are able to produce that into resulting in decay. So we need to be very, very mindful about what goes into our children's mouths, and I think that's the biggest issue and the thing that we've really fallen down upon.
So what are some of the things that we can actually, what are those things that we need to look at to prevent, and how do we also stop that decay from forming?
Really, really clear guidelines. Water only.
Yep.
Only water.
Yep.
Water only. That's it for drinking. And trying to minimise the number of times our children snack during the day. So breakfast, lunch, dinner, morning tea, afternoon tea, and that's it. The ability for kids to have a little bit now and a little bit now and a little bit in another hour means that their teeth don't get a chance to recover from that acid, and the bacteria is able to cause significant amount of damage. So really trying to limit our snacks. As babies, we want to be fed every few hours. We talk about babies getting down to 3 hours and 4 hours between feeds, but then as toddlers, and as they're starting to access food, we're often bringing those times closer together. So just maintaining those set meal times, providing meal food at all of those times. So lots of children by 6 o'clock in the evening, to try and get them to eat a meal is very difficult. So providing them with meal food at 3 o'clock in the afternoon for afternoon tea, so that they're only needing a top up, and we can maintain good nutrition and protect the teeth.
Wow. So the whole time we haven't even talked about brushing. So of course that's an integral part,
yes,
but there's so many other things that we can do.
Absolutely. Brushing twice a day. If there's no plaque, you can't get decay.
Yes.
So getting that plaque off, particularly at night. I really like safe brushing, particularly with young children. So that means for a young child, when they're in a high chair in a safe eating spot, as you're cleaning up, cup of water, wet toothbrush, they can start to have a play and explore their mouth, but they're in a safe position so that they're not going to get trauma from their toothbrush in their mouth. And in that position, once they've had a turn, you can actually get in and have a good go, and kitchens generally are well lit. so that you can get in there and give them a good clean. But we want cleaning twice a day. In terms of some fluoride, a little bit of fluoride once kids are around 10 to 12 kilos.
Yep.
But that's something that can be discussed at a first dental visit, the timing of when fluoride comes in, because we do like to be quite prescriptive as to when we advise that.
Wonderful, that's fabulous information. I'm sure there's lots of parents who that was really helpful for you. Now tell us, paediatric dentistry. How did it come to be that you fell into doing this?
Well, my journey with paediatrics started a long time ago. I actually did my work experience in the field of paediatric physiotherapy
Right.
as a schoolgirl, and loved working with that population, loved working with the growth and development, the special needs, the complex kids, and loved that. Life moved on and I went and did my undergrad dentistry, and after a few years of practice I felt that I wasn't doing things as well as I could, and so I went back to Melbourne, and embarked on the 3-year training program that leads to specialisation. So,
wonderful.
Yeah, done at the University of Melbourne.
And so what is the difference between, say, normal dentistry and, say, a paediatric dentist? Of course you work with kids, but what is the area that particularly you have to specialise in to deal with kids?
So in that 3-year program, we do a lot on growth and development.
Yep.
We spend a lot of time with our medical colleagues, so the paediatricians, paediatric endocrinologists, paediatric cardiologists, ear, nose and throat surgeons, oncologists. We work with them very, very closely and learn a lot more about the needs of those children because they are quite specific, as well as working with growth and development. So it is an intense 3 years of training. So
Absolutely.
Yes. Yeah.
And so for parents out there, why would they want to bring one of their kids to see you rather than just go and see your general dentist? Obviously there's some specialised things.
Yeah,
But
absolutely.
just any other reasons?
And one of the big things that we work on is behaviour management. So a lot of our work is on behaviour management, and certainly you talked about fear. There are two sorts of fear that we tend to find in the world of paediatric dentistry. One is the fear of the unknown, which most children have, and that's a very sound fear for them to have, not knowing what's going on and being able to communicate through that, and actually teaching them and empowering them is very important. The other is the fear because of a previous difficult experience, and that's what we try to be preemptive at avoiding, so that our kids don't have a difficult experience, so that they can enter adult life empowered about their oral health and what they can do at the dentist, and sometimes what they can't do. It is a very disempowering position when you're lying down and your mouth's open and we're in your airway and in your main area of communication. We're working in your mouth, so to speak is difficult, to breathe can be difficult. So it is a very disempowering situation, and some people will always struggle with it.
So what are some of the techniques or things that you use to actually alleviate some of that stress and some of the anxiety for the kids?
Look, the primary one is tell, show, do. We talk about it. We have a look at it on our model.
He's great, isn't he? I love him.
We show you on the model, we show you on your fingers, we show you things that feel different. We then describe it in language that is safe language for kids. So sometimes things are uncomfortable, but to say this is going to feel tight, it's going to feel tight for 10 seconds, we're going to count to 10 together, and then we know that feeling's going to go. So defining those things, providing them with the language, because children at that age don't have that what we call the linguistic maturity to know and to be able to describe things. So for a baby, if things aren't perfect, if things aren't right, if they're hungry, if their tummy feels a bit tight, they cry because it's either good or it's bad. And there's no grey, and actually providing them with those skills and that language so that they can say, that tight feeling's okay, but can we make it for 5 seconds? And they can negotiate then if you provide them with those skills and those tools.
Wonderful. So when should kids come? Like, when should they start coming in to see the dentist, would you recommend?
Well, look, I don't see grown-ups, but I like to think that mums are going along and dads are going along when the bub's growing in utero. And getting their oral health in shape. Because we know that if their oral health is poor, the oral health outcomes for their children are going to be compromised. So we want the mums, when they're having their 20-week scan, being advised, now pop along to the dentist, make sure your oral health is fine. From us, before 2 is what we describe. So we like seeing kids around 1, particularly our children who have been preterm, have been sick in the neonatal period, have had a mum who was sick, because this is the time that we can be looking for teeth which may be more at risk and providing them with a greater level of preventative care and providing the family with strategies so that their child's teeth can be as good as we can make them.
So there are strategies that we can actually employ to actually help make sure that our teeth actually grow to be not needing braces and things like that?
Look, in terms of growth, certainly habit cessation and talking about habits is something that we do a lot of. Tooth size and jaw size variations are always going to happen. But put a habit in there, then that's going to affect it. And they're the things that we can really work with families to try and help protect against habit-induced malocclusions and teeth which aren't straight because a thumb has been there or a dummy's been there, or they've had a finger chewing type habit.
Wonderful. Okay, so look, it's been wonderful to hear some of that advice that you have and what you do. Finally, for the parents out there, what would be your top 3 tips around good oral hygiene and health for your kids' teeth?
Okay, number 1, brushing twice a day. Number 2, drink water only. Number 3, limit snacks. Try to bring your children's meals times down to 5 a day. So breakfast, morning tea, lunch, afternoon tea, dinner, and between that, water only. Wonderful.
Look, that's simple, straightforward, but very easily doable, and I'm sure it'll have an amazing impact on our kids when we do that.
Because the current trajectory, it doesn't look good for the smiles of our little people, and that's what we want to protect.
Totally agree. Look, thank you so much, Helen, for
My
your
pleasure.
time. Really appreciate it.
Nice to see you, Dragon.
Yeah, Dragon, he's done very well. I just love those teeth, they're awesome. Look, and thank you everyone for joining us. I'm sure you found that absolutely fascinating to hear about and get some insight into teeth and what you can do for your kids. If you have any questions for Helen, I'm sure she'd be more than happy to answer a few of your questions, so please comment. If you want to find any more information about Helen and this amazing business here, all the details of it will be on the screen right now. Look, thanks for joining us. We'll see you same time, 12:30 next week. Remember, healing is a gift, health a responsibility. See you later.
Bye.
Thank you.
Thank you.